I need a minimally invasive treatment for my under eye bags. Any suggestions? I've had dark circles and under eye bags for as long as I can remember. Now that I'm in my early 30s, it's more pervasive than ever. I'm an actor, and now that everything is in HD, I feel as though my eyes make me look older than I am. I am leery of needles and despise the idea of surgery. What should I do?
Thank you for your question. You submitted a photo, and in the question, you're looking for a minimally invasive solution for your under eye bags. You state you've had them for as long as you can remember. You're in your 30s. You're concerned about, as an actor, the realities of HD or high definition. And in addition, you mentioned in the question that you're leery about needles and you despise the idea of surgery. Well, I think I can help you with this question. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial and oculoplastic surgeon. I've been in practice in Manhattan and Long Island for 20 years, and eyelid surgery is a big part of my practice. I'm a specialist in this area for both cosmetic and complex reconstructive eyelid surgery. So the way you phrase your question certainly is reflective of what is common for many people before they seek a definitive procedure. And so let's begin by just defining what the situation is with you. Why do you have puffiness under your eyes, and why is it that it is getting worse as you're getting a little bit older? It's been around for as long as you remember. Well, it's because it represents a hernia, a herniation of fat. Now, this fat has nothing to do with body fat. It is fat that's normally around your eyes and has pushed forward, and we refer to that as herniated fat. What many people do who come to us is they first try the quote minimally invasive approach, which is usually skin creams. So they go to the store and they buy anything that says will help under eye puffiness. And the reality is, for fat prolapse, nothing will ever work. That's topical. So beyond, once they get past that, then they start looking at quote other minimally invasive options. But the reality is that there has to be a procedure that addresses the fat. Now, currently there are two popular approaches for people who are on the border in terms of the relative puffiness. And since we don't have a side view picture and we're not doing a full physical examination, the amount of fat prolapse beyond a certain point leaves you with only one option, and that is surgery. And so although you may despise the idea of surgery, no one wakes up in the morning and says, I can't wait to have surgery. It is probably going to be the most definitive procedure for you at some point. Now, before you undergo a surgical procedure, if your puffiness is slight, then we have had success with placement of fillers in the groove called the tear trough or nasojugal groove. And that area, we're able to add some volume to try to soften the transition. Now, I am hesitant about suggesting that to you, besides the fact that you don't like needles, but as someone who's an actor and you're dealing with HD and 4K and all the other things that show way more detail than anybody ever wants to ever see or show, the reality is that if you end up with a slight bit of puffiness or irregularity or lumpiness, then it will be problematic for somebody whose life is in front of a camera. I think that most likely for someone like yourself, and we're in Manhattan, and we have taken care of a lot of actors and people who are in front of a camera, journalists, etc. Usually a definitive procedure is more appropriate. And so it's worthwhile considering something called a transconjunctival blepharoplasty. What a transconjunctival blepharoplasty is approaching and correcting the puffiness under the eyes from inside the eyelid. So this way you can avoid an incision and you can avoid any external sign of having surgery. Now, in terms of, quote, other objections to surgery, in our practice, what we do is we do these procedures under local anesthesia with light sedation. So that takes away a big fear for a lot of people, which is about general anesthesia or being out or having a tube in your throat. We do these procedures in our facility, in our office, which is a much more, I think, comfortable situation for many patients because they know the staff and they're comfortable, and we don't work like a hospital or surgery center where we're doing high volume. It's much more of a boutique, personalized care. And in the end, when you do a procedure like this, it's done for a long time. For younger people, it can last for 20 plus years. The typical lifespan when we talk about in consultation is that the eyelid surgery, depending on the age you're at, can have a longevity that's not about the fat coming back or the skin getting very wrinkled, but it's about the facial aging more globally. So for a younger person, and I believe I classify people in their 30s as younger, then it's probably going to last you a very long time. There won't be maintenance involved. And so if there is going to be any maintenance, it might be more of topical skin quality and maybe even something to help the skin quality from the inside, like the use of platelet-rich plasma. But that's a separate topic, and really we're talking more about the puffiness. So I think that you need to open your mind a little bit and look into this option of having more definitive treatment. And once you are more ready to accept that, then move forward and meet with qualified, experienced surgeons who do a lot of cosmetic eyelid surgery. For an actor, your looks matter, and you don't have room for complications and problems and things like that. So I always lean towards people who really specialize when making recommendations. We always want to treat people like we treat our own family. So I hope that was helpful. I wish you the best of luck, and thank you for your question.